Oops. There are over 280 million cows in the world, and the number one disease affecting them is actually bovine mastitis, a bacterial infection of the mammary gland caused mainly by E. coli and Streptococcus aureus. Despite decades of prevention efforts, mastitis remains highly prevalent. About 15% of the global cows suffer clinical infections every year. The economic impact is enormous, more than US $10 billion of global losses every year from discarded milk, but also low productivity, veterinary costs, and also premature culling. Well, here's the problem. The only mainstream treatment today is antibiotics. This creates three major issues. First, milk withholding or contamination. After antibiotic treatment, farms must discard milk for up to 11 days due to antibiotic residue present in the milk. Second, relapse. Many cows actually develop chronic recurring infections and eventually need to be culled. Third, the overuse of antibiotics is accelerating antimicrobial resistance issue, which is now a major global health threat. At NTU and MIT, we have developed a next generation polyimidazolium-based antimicrobial solution, a biodegradable polymer that kills bacteria rapidly and effectively. Unlike antibiotics that target specific protein, our compound utilizes a unique mechanism to kill the bacteria. The unique carbon chemistry also ensures that it's effective at killing in low concentrations and in the presence of milk. So our solution delivers on three major breakthroughs. One, no milk withholding. Our polymer is biodegradable with no detectable residue within 24 hours after the last treatment. Second, superior efficacy with no relapse. In trials, we achieve rapid pathogen eradication with no relapse of infection after treatment. Third, no contribution to antimicrobial resistance issue because our mechanism does not rely on conventional antibiotic pathways. In short, we're not creating another mastitis treatment. We're actually creating a platform technology that can break the antibiotic cycle in animal health. And the opportunity extends far beyond dairy cattle into aquaculture, poultry, and eventually human therapeutics. Our solution is safe, highly effective, easy for farms to operate, and also cost-effective to manufacture. We've already completed successful farm trials in China and Malaysia, and we're right now advancing additional trials with FNN Agri Valley in Malaysia. Alongside regulatory registrations in New Zealand, we are targeting first commercial sales by 2029. Our technology is backed by a strong IP portfolio, a recent publication in Nature, and also early interest from leading veterinary pharmaceutical companies, including Virbac and Merck MSD, Australia. Today, we're raising US $1.5 million to complete regulatory and commercialization milestones. Bovine mastitis is a US $10 billion global problem that's still dependent on outdated antibiotic solutions. PIMECO offers a safer, better, and more sustainable alternative, one that can transform dairy economics while addressing one of the world's biggest antimicrobial resistance challenges. Thank you.
Okay, now please stay on the stage. Let's move on to the 3 minutes Q&A.
Yeah, sure. As the CDO of PIMECO, I'll happily take this question. So if we look into the traditional antibiotics, what an antibiotic does, it has to go through this bacterial envelope. It's a very slow diffusion process, so it kills bacteria really slow, within hours of time. And second, the target is a specific proteins. So the bacteria is very smart. It's very easy for them to evolve a resistance just by changing a single point in the protein that you lose the activity. So we have a slow killing coupled with rising AMR issues for antibiotics. What happens with the PIMECO polymers is it's a cationically charged polymers, but has the ability to transiently lose the charge when it is at the vicinity of the bacterial membranes. It becomes a more hydrophobic form, and the biophysical interaction makes it quickly translocate through the bacteria by layers. This happens within minutes. And once it goes into the cytosols, it binds to macromolecules, for example, the DNAs. Because this is not a single point, single interaction, bacteria couldn't just evolve to lose their DNAs. So it is very hard for bacteria to evolve resistance to the PIMECO polymers. So in summary, we have a very fast uptake and very fast killing, and we are avoiding the AMR issues. So that is the carbon chemistry is actually the key differentiation compared to the antibiotics.
For further details, please refer to our Nature publication, which we are happy to share with you.
One more question here. You referenced your pilots. I think you have one in 2021 in China and the other one is 2025 in Malaysia. So that's quite a bit of a gap. I just want to understand what takes so long.
Well, part of it was that the first farm trial was actually done during COVID. It was very difficult to get onto a farm during COVID. And then since then, it was actually still in the lab. So I joined the team after this thing came into one of my courses in pitching and fundraising. And then subsequently, I joined the team in 2023 as a co-founder. And then we started taking it off to the next stage, which is where we started the farm trial last year.
I can probably add on. I think what we're actually doing within the 2 to 3 years is basically working on the manufacturing process. When we're doing the first trial, we're using the first generation of the molecules where we're having a very low yield. So within the 2 to 3 years, we increased the yield by 20 times. That enabled us to do the subsequent Malaysian farm trials. We started with the Chinese trial with only 9 cows, and we're doing the Malaysian farm trials with 30 to 40 cows with much longer duration of time. So we are really working on not just the tech itself, but also in terms of the manufacturing and the scaling up capabilities in lab.
Okay, sorry, that is the last question. And thank you, PIMECO. We'll move on to the next team. Let's welcome
Thank you.
Biotech.